I'm about to show you a 60-second movement pattern that stimulates the neural pathways responsible for memory recall and cognitive processing. Many people over the age of 70 accept memory slips, brain fog, or the inability to find the right word as a normal, unavoidable part of aging. However, new understandings of neuroplasticity suggest that these moments of confusion often stem from a lack of specific stimulation rather than permanent decline. If you rely solely on standard advice like solving crossword puzzles or reading more books, you might be missing the physical mechanism required to keep the brain's communication highways open. I'm Dr. James Williams, and in my years of practice, I have worked with hundreds of seniors who feared they were slowly losing their independence because they could no longer trust their own minds. I have seen patients who stopped driving, stopped cooking, and withdrew from social conversations because they were terrified of forgetting a name or getting lost in a familiar sentence. You may have noticed subtle changes yourself, perhaps walking into a room and forgetting why you are there, or struggling to follow a fast-paced conversation at the dinner table. While some changes are expected, a consistent feeling of mental clouds or difficulty initiating tasks is a signal that your brain needs better circulation and stronger neural firing patterns. Your doctor might have told you to simply rest more or accept it, but ignoring these signs can lead to a more rapid decrease in cognitive function and overall confidence. We are going to correct this today by introducing physical and dietary inputs that directly target the health of your brain tissue and the speed of your neural connections. Perform a cross-body marching movement for 60 seconds every morning. This simple action forces the two hemispheres of your brain to communicate rapidly across the corpus callosum, which is the bridge connecting your logical and creative sides. This coordinates your physical body with your mental processing speed. I treated a 74-year-old patient named Arthur who had begun to withdraw from his weekly card games because he could not remember the rules or follow the play. He felt embarrassed and assumed his social life was over, but after incorporating this daily movement, he reported that his ability to focus on the game returned within 3 weeks. He stopped feeling overwhelmed by multiple stimuli and regained the confidence to rejoin his friends. This exercise works because your brain controls your body in a contralateral way, meaning the left side of your brain controls the right side of your body, and the right side of your brain controls the left side of your body. When you deliberately cross your limbs over the center of your body, you force both sides of the brain to talk to each other simultaneously and rhythmically. This increases the processing speed of the neural network and wakes up the synaptic connections that often go dormant when we live a sedentary or routine-heavy lifestyle. It is a wake-up call for the nervous system that alerts your brain that it needs to be ready for complex coordination. To do this, stand with your feet shoulder-width apart in a safe, clear area where you have a wall or a sturdy chair nearby for balance if needed. Slowly lift your right knee up toward your waist level, while simultaneously bringing your left hand down to tap that knee. Return your foot to the floor and your hand to your side, and then immediately lift your left knee and tap it with your right hand. You are marching in place, but the critical component is the crossing of the hand to the opposite knee. Do this rhythmically, but not quickly. The goal is precision and deliberate movement, not cardiovascular exertion. Count the repetitions out loud if you can, as this adds another layer of cognitive demand that strengthens the exercise. Continue this alternating march for exactly 60 seconds, breathing deeply and rhythmically through your nose throughout the entire minute. If standing is difficult or you feel unsteady, you can perform this exact same movement while seated in a sturdy chair with your feet flat on the floor. Simply lift the knee and tap it with the opposite hand while keeping your back straight and your core slightly engaged. Be careful not to rush the movement or hunch your shoulders forward, as this creates tension in the neck that we want to avoid. This supports steadier neural firing and better physical balance throughout the day. Train your grip strength daily using a resistance tool or a simple household object. There is a strong, scientifically observed correlation between the force of your hand grip and the density of the white matter in your brain. Maintaining strong hands is not just about opening jars, it is about maintaining a robust nervous system that can send strong, clear signals. I remember a patient named Martha who was 71 and complained constantly of feeling weak-minded and physically frail. She often dropped items in the kitchen and felt that her mental clarity was fading along with her physical strength. We introduced a simple daily grip routine, and as her hand strength returned, she described a lifting of the fog and a renewed sense of capability in managing her daily tasks. The brain requires a significant amount of neural drive to activate the muscles in the hands and forearms strongly. When you forcefully squeeze an object, you are sending a high-magnitude signal from the motor cortex of your brain down through the nervous system. If you stop using your hands for difficult tasks, that neural pathway degrades, and the brain area associated with it can actually shrink or become less active. By deliberately training this, you preserve the integrity of the nervous system and improved overall reaction times. It signals to your body that you are still active, capable, and requiring of maintenance, which triggers hormonal responses that protect brain tissue. To do this, you can purchase a simple hand gripper, a stress ball, or even use a tightly rolled up hand towel. Sit comfortably with your shoulder relaxed and your elbow bent at a 90-degree angle, keeping your elbow close to your side. Squeeze the object in your right hand as hard as you comfortably can for 5 seconds, then release for 5 seconds. Repeat this squeeze and release cycle 10 times on the right hand, and then switch to the left hand and do the same. Focus on the sensation of the muscles contracting in your forearm and try to keep your breathing steady. Do not hold your breath while you squeeze. Do this once a day, perhaps while watching television or listening to the radio. If you have arthritis or pain in your hands, use a softer object like a foam sponge and focus on the movement rather than the intensity of the squeeze. Do not push through sharp pain in the joints, as we want to stimulate the muscles and nerves, not inflame the skeletal structure. This preserves the neural drive required for independent living. Practice a dual-task walking routine inside your home. Walking while performing a simple mental task trains the brain to manage motor function and cognitive processing simultaneously, which is a critical skill for preventing falls and maintaining attention. This mimics real-world scenarios where you must navigate an environment while thinking, talking, or making decisions. I treated a 78-year-old man named Robert who had suffered 2 minor falls because he would stumble whenever he was distracted by a noise or a thought. He had lost the ability to multitask safely, which made him fearful of walking in public spaces. After practicing this dual-task method in his hallway, his balance improved significantly, and he reported being able to walk and talk with his grandchildren without having to stop to concentrate on his feet. As we age, the brain often starts to prioritize physical safety over cognitive processing, meaning it takes significant brain power just to walk steadily. If you add a cognitive task on top of that, the brain can become overwhelmed, leading to either a stop in movement or a lapse in memory. By deliberately practicing this combination in a safe environment, you increase your cognitive reserve. You are teaching your brain to re-automate the walking process so that it requires less conscious effort, freeing up mental energy for thinking, observing, and reacting. This improves your gait speed, your reaction time, and your ability to filter out distractions. To do this, find a clear hallway or a spacious room in your home where there are no rugs or obstacles on the floor. Start walking at a normal, comfortable pace back and forth. Once you have a steady rhythm, begin to count backward from 100 by subtracting 3 each time, 100, 97, 94, 91, and so on. If math causes you anxiety or frustration, you can instead try to name as many animals as you can, or list words that start with a specific letter. The goal is to keep your feet moving steadily while your mind is engaged in the puzzle. If you find yourself stopping walking to find the number or the word, that is okay. Simply start walking again and continue. Do this for just 3 to 5 minutes a day. Be very careful to ensure your path is clear of pets, cords, or furniture edges before you begin. If you feel dizzy or unsteady at any point, stop immediately and stand still or sit down until you feel stable. This builds a brain that is resilient against distraction and confusion. Consume a serving of dark berries before you eat any other carbohydrates in the day. Eating blueberries, strawberries, or blackberries provides a concentrated dose of flavonoids, which are compounds that increase blood flow to the brain and reduce inflammation. Prioritizing these early in the day sets a metabolic tone that favors cognitive clarity rather than the sugar crash that often follows a standard breakfast. I had a patient named Sarah, age 68, who loved toast and jam for breakfast but complained of feeling tired and unfocused by 11 a.m. She struggled to manage her household finances and often made simple errors due to this mid-morning mental fatigue. We switched her routine to include a cup of blueberries before her toast, and she noticed a steady, sustained energy that allowed her to focus on her tasks well into the afternoon. Berries are unique because they have a low glycemic index, meaning they do not cause a rapid spike in blood sugar, yet they provide glucose, which is the brain's primary fuel source. The specific antioxidants in berries, particularly anthocyanins, have an affinity for the brain's learning and memory centers. They help to clear out metabolic waste products that accumulate in the brain and can slow down processing speed. By eating them before other carbohydrates, you dampen the insulin response of your entire meal, keeping your blood sugar, and therefore your brain energy, stable. This prevents the mental fog that comes from fluctuating glucose levels. To do this, simply wash half a cup to 1 cup of fresh or frozen berries. Eat them as your first bite of food in the morning, or as a dedicated mid-morning snack. Chew them slowly and thoroughly to aid digestion. You do not need to buy expensive exotic berries. Standard blueberries or strawberries from the grocery store are incredibly potent. If you have diverticulitis or specific digestive issues with seeds, you may need to strain them or choose a different fruit like dark cherries, but for most people, the whole berry is best. Do not cover them in sugar or heavy cream, as this negates the stabilizing benefit we are looking for. This provides the raw materials your brain needs to repair and protect itself daily. Here is another simple habit. Hydrate immediately upon waking with a full glass of water before drinking tea or coffee. The brain is physically composed of a high percentage of water, and even mild dehydration can manifest as confusion, memory lapses, and slower reaction times. During sleep, you lose a significant amount of fluid through breathing and perspiration, meaning you wake up in a naturally dehydrated state. I often see seniors who believe they are losing their edge, when in reality, they are simply chronically dehydrated. By drinking water first thing, you restore the fluid volume necessary for neurotransmitters to travel efficiently across the synapses. It also helps to flush out toxins that the brain has processed during the night. Keep a glass of water on your nightstand or right next to your bathroom sink so it is the first thing you see. Drink it comfortably. It does not need to be ice cold or hot. Just room temperature is fine. This ensures your brain is hydrated before you demand any work from it. One more easy change you can try is practicing single tasking for 1 hour a day. Choose one activity, whether it is eating lunch, folding laundry, or reading the newspaper, and do it with complete, undivided attention. In our modern world, we are often encouraged to do 3 things at once, but the aging brain functions much better when it can devote its full resources to a single objective. This practice reduces cognitive fatigue and lowers the levels of cortisol, the stress hormone, in your body. High cortisol levels are toxic to the hippocampus, the part of the brain responsible for memory. By slowing down and focusing on one thing, you protect this vital area of the brain. Simply turn off the television, put away the phone, and focus entirely on the texture of the laundry, the taste of the food, or the words on the page. This calms the nervous system and improves your ability to encode that specific memory for later recall. Eat a dinner rich in omega-3 fatty acids 3 times a week, prioritizing fatty fish like salmon, mackerel, or sardines, or plant-based sources like walnuts provides the essential fats required to build and maintain brain cell membranes. The human brain is roughly 60% fat, and the quality of that fat determines how well your brain cells can signal to one another. I treated a 72-year-old patient named Elias, who survived mostly on processed meats and boxed dinners because they were easy to prepare. He felt that his memory was slipping away, and he had trouble learning new things, like how to use his new smartphone. After we adjusted his diet to include simple baked salmon and a handful of walnuts regularly, he reported feeling sharper and less frustrated with new information within a month. Omega-3 fatty acids, specifically DHA, are critical for maintaining the fluidity of cell membranes. When membranes are fluid and flexible, neurotransmitters like dopamine and serotonin can pass through them easily, facilitating quick thinking and stable moods. Conversely, a diet high in saturated fats or inflammatory oils can make these membranes rigid, slowing down communication. These healthy fats also have a powerful anti-inflammatory effect, reducing the low-grade inflammation that is often a driver of cognitive decline. By eating these foods at dinner, you provide your brain with reparative materials right before it enters its nightly restoration cycle during sleep. To do this, aim for a portion of fatty fish roughly the size of a deck of cards for dinner on Mondays, Wednesdays, and Fridays. If you do not eat fish, you can consume a tablespoon of ground flax seeds or a small handful of walnuts daily. Simple preparation is best. Baking, grilling, or steaming the fish preserves the healthy oils better than deep frying. Avoid breaded or battered fish sticks, as these often contain unhealthy oils that counteract the benefits. If you are on blood-thinning medication, just mention this dietary change to your doctor, as omega-3s can have a mild blood-thinning effect. This fuels the physical repair of your brain's communication infrastructure. Perform a recall visualization practice for 2 minutes every evening. Before you fall asleep or while relaxing in your chair, mentally replay the events of your day in reverse order, starting from the present moment and working backward to when you woke up. This specific mental drill strengthens the neural pathways associated with short-term memory and prevents the blurring of days that many seniors experience. I recommended this to a patient named June, who was 76 and distressed because she could never remember what she had done just a few days prior. She felt her life was passing without her retaining it. After practicing this reverse recall technique for a few weeks, she found she could remember details of conversations and appointments with much greater clarity. When you passively go through your day, your brain dumps much of the information into a temporary holding area. Unless you actively review it, that information is often discarded during sleep as irrelevant. By deliberately retrieving these memories in reverse order, you force your brain to tag these events as important. The effort of working backward is key. It disrupts the brain's tendency to gloss over details and forces you to reconstruct the timeline actively. This engages the hippocampus and builds denser neural connections for episodic memory, the memory of autobiographical events. It turns passive living into active remembering. To do this, close your eyes and sit or lie comfortably. Ask yourself, what did I just do? Brushed teeth. What did I do before that? Watched the news. And before that? Ate dinner. Try to visualize one specific detail from each event: the color of the news anchor's tie, the taste of the chicken, the temperature of the water. Do not worry if you cannot remember every single detail. The effort of trying is what builds the strength. Go back as far as you can until you reach your morning coffee or until 2 minutes have passed. Do not judge yourself for forgetting things. Simply note the gap and move to the next available memory. This signals to your brain that your daily experiences are valuable and worth saving. Take a structured 20-minute power nap in the early afternoon. A short timed rest between 1 p.m. and 3 p.m. allows the brain to consolidate memories and clear out metabolic waste without disrupting your nighttime sleep. Unlike a long, groggy slumber, a power nap acts as a system reboot for cognitive function. I had a patient named Henry, an 80-year-old retired engineer, who pushed himself to stay awake all day despite feeling exhausted, believing that napping was for old people. By late afternoon, he became confused, irritable, and forgetful, a phenomenon often called sundowning. We introduced a strict 20-minute rest period after lunch, and his evening confusion virtually disappeared. During waking hours, your brain accumulates a chemical called adenosine, which creates sleep pressure and slows down neural firing. A short nap reduces adenosine levels just enough to restore alertness, but not so much that you cannot sleep at night. Furthermore, even light sleep allows the brain's glymphatic system, its waste clearance plumbing, to flush out toxins that can damage cells if allowed to build up. It also moves information from short-term storage to long-term storage, effectively saving what you learned in the morning. To do this, set an alarm on your phone or clock for 20 minutes. Lie down in a comfortable spot or recline in your favorite chair, perhaps with a light blanket. Close your eyes and focus on relaxing your muscles. Even if you do not fall completely asleep, the rest state is beneficial. When the alarm goes off, get up immediately. Splash some water on your face or move around to shake off any grogginess. Do not nap after 3 p.m. and do not let the nap extend beyond 30 minutes, as this can lead to sleep inertia, where you wake up feeling worse than before. This clears the slate for a productive and clear-headed evening. Engage in novelty exposure once a week. Deliberately expose your brain to something completely new, a new route to the grocery store, a new genre of music, or a new recipe, to stimulate neuroplasticity. The brain is an efficiency machine. It loves routine because routine requires less energy. However, strict routine leads to neural atrophy because the brain stops creating new connections. I recall a patient, a lovely woman who had lived in the same neighborhood for 40 years and walked the exact same path every single morning. She was losing her sense of direction in other parts of the city. I challenged her to simply walk her route in reverse or to drive a different way to the post office. She reported that this small change made her feel more awake and observant, and her spatial awareness improved. When you encounter something new, your brain releases a flood of neurotransmitters like norepinephrine and dopamine to help you pay attention and learn. This chemical bath promotes the growth of new synaptic connections. It is like forging a new trail in a forest. The first time is hard, but it opens up new territory. By keeping your brain slightly uncomfortable with newness, you prevent it from going into autopilot mode permanently. To do this, choose one simple thing to change this week. Listen to a jazz station instead of the news for 30 minutes. Brush your teeth with your non-dominant hand, left hand if you are right-handed. Sit in a different chair at the dinner table. Notice how strange it feels. That sensation of strangeness is literally your brain growing. Do not overwhelm yourself with big changes. Micro changes are sufficient. This keeps your mind flexible and ready to adapt to challenges. Practice box breathing when you feel a memory lapse. When you forget a name or why you entered a room, stop immediately and perform 4 cycles of rhythmic breathing. Panic is the enemy of memory. When you can't remember something, your body often produces a stress response, tightening the chest and flooding the brain with cortisol, which effectively shuts down the memory centers to prioritize survival. By breathing deeply, you signal safety to your nervous system, reopening access to the information you are looking for. I teach this to almost all my patients who struggle with tip-of-the-tongue moments. Instead of getting frustrated and forcing the memory, which usually pushes it further away, they pause and breathe. Often, the name or word pops into their head a few moments later effortlessly. To do this, inhale slowly through your nose for a count of 4. Hold that breath gently for a count of 4. Exhale slowly through your mouth for a count of 4. Hold the empty lungs for a count of 4. Repeat this square pattern 3 or 4 times. Focus entirely on the counting and the sensation of air. This resets your focus and lowers your heart rate. This allows your brain to work calmly rather than under emergency conditions. Reduce background noise in your home. Turn off the television or radio if you are not actively watching or listening to it. Constant background noise forces the brain to filter out irrelevant auditory data continuously, which drains cognitive energy that could be used for memory and focus. For a senior brain, filtering out noise becomes mechanically more difficult and energetically more expensive. Creating quiet zones in your home gives your brain a rest from this constant filtering task. It allows you to hear your own thoughts clearly and improves your ability to concentrate on the task at hand. Simply press the mute button or turn the device off completely during meals or while reading. You may be surprised by how much more relaxed and clear-headed you feel in the silence. This preserves your mental energy for the things that truly matter. If you know someone over 50 who could benefit from this, share this video and subscribe for more simple health tips.